Okay.
Because you can get, are you getting a video or are you taking pictures?
No video, is that okay
Yeah,
or
no,
not?
totally, that's great. Because pictures, it's always like a little unclear what's happening.
Yeah,
So, again, that segment of bone still exists, but from a chin standpoint, the chin is still moving forward, which is a weird way to think about this, but it's just moving less forward than
Okay.
what it would be if we didn't do chin surgery. And so it's hard not to look at the chin when you're missing a center segment, but you can see how we're moving things forward. The goal of this is obviously creating space for you to breathe, which from below, you'll kind of see why that's the case. So from an advancement and expanding standpoint, the upper jaw is expanding. Kind of talking to you how these surgeries go. I'll talk you through the overall how far I'm moving it here in a little bit, but from a extension standpoint, so there's these 2 incisions inside your mouth. So from the soft tissue is kind of helpful. So from those syringes that Andrea was talking to you about, don't use those between the front teeth. Point them up a little bit higher, because if you point them down, it'll go into this incision back here. So just be careful with those things. So the gum incisions inside your mouth will have dissolvable stitches. The right side is a little bit different than the left side in that you have an extra. You're missing a tooth on the right side, so on the left side you have the normal kind of sequence of teeth, and on the right side you're missing that back tooth. So what that means typically when it comes to this sort of surgery, so lower jaw surgery advances the teeth and the tongue forward, but I need to put plates and screws to hold it in place. So plates and screws are typically just a little plate like that and 4 little screws. Those don't set off alarm at the airport. You can get an MRI, and they live right here. When you're missing a tooth back here, I tend to need to put extra fixation in, and it's usually because during surgery with that plate, there's still a little bit of play, and I want this bone to heal, right? So bones don't heal if there's wiggle to them, and so there's benefits of using that plate, but I'll have to likely put an extra screw in there. An extra screw sits right here where my little cursor is, and the reason why I'm bringing this up just has to do with where that is on in your mouth is typically too far back for me to work from just inside your mouth. So it's possible there'll be a little scar on your face. A little scar on your face doesn't tend to be that big of a deal, but I would want to know if I was going to have that. Like this lady's my example of this, because most people when they wear makeup you can't see it, or when they have beards, you can't see it. But do you see these little screws that are holding the bone in place? So she had jaw surgery, and if we look at her cheek, do you see this blemish right here?
Yeah.
So that blemish after surgery has a partner, so it's that scar. So you don't see it from the front. It doesn't create a dimple, but it's that thing. So it'll be a single stitch back there. A lot of people, like, let's say this lady, she's got a couple skin blemishes, and then after surgery she comes in with makeup, and I don't know which is the new one, right? Like I can't tell. So I don't think it's all that problematic, but when people hear about scar on their face, it usually gets your ears
Now,
start hearing it.
will those be issues like when she's the plate? Will she feel this
No.
inside her mouth, like down inside?
No, so I mean, this one for sure you won't feel. This one you can if you push on your face, but you won't feel it inside your mouth. You
Okay,
won't see it.
so it won't hang up food or anything. You know?
Nothing. Yeah, you really, like you won't really know all this stuff is going on until you see the X-ray. Your face will be puffy, but like from
Yeah.
what I'm showing you, this is all stuff that you won't see.
Mhm.
There's this nerve that runs in the bone. The nerve is the one that gives feeling to your lip and chin. That lives in a little canal that lies right where this line, where the split's going to happen, right through here. And so that nerve can be cut or torn during the operation. I see that about 1 in 500 of these operations, so it's pretty unusual. I would fix it and then tell you about it if that happened. You're not at high risk for that. Generally, nerve trouble when it comes to this operation is because the yellow and the blue are bumping into each other. So if we look at that from below, you'll see how the yellow bit widens as the lower jaw moves forward. You see how it's kind of like pushing it out? So the lower jaw, as it pushes these segments out, what's happening on the nerve level is the little tube that the nerve lives in is getting smaller and it can pinch the nerve. So during surgery, I'd fix that by taking away bone. The important thing though is we want the nerve and the bone to heal. So taking away bone has a downside to it. And so I'll put some bone graft in here. So bone graft would be placed to help the bone heal. There won't be a need for nerve grafting or anything like that, but bone tends to heal on about a 2 to 3 month timeline. Nerves will be more like a 6 to 9 month timeline, so it'll take a little bit longer to heal. Total numbness, you'll have it right after surgery because of local anesthesia. By the next day, you'll start getting some sensation back. It's just that it's slow, so it'll start like itching in different spots, and there's so many different nerves, it's kind of confusing. So it'll be normal for one side to be more than the other. And we give you some nerve protecting medicine. That's the Neurontin business. That has to do with helping the nerve heal in a non-painful way. So what I think the worst outcome in terms of nerve trouble is that it hurts, that you have pain. The second worst thing is that you have total numbness. Both of those are very rare actually. So they're, I don't even know what percent they are, but they're under 1% type things. I don't have a great feel on how frequently I see those because it's, I think it's less common than 1 in 500, but still, we want you to heal. Bone healing trouble is usually around biting and chewing. You strike me as someone that's going to do just fine with this, so I'm not worried about it, but be careful with the diet because biting and chewing can cause these things to wiggle. So infection comes up in the lower jaw almost exclusively. It does happen on top, but it's usually a lower jaw problem. So infection is the reason why we give you antibiotics, keeping the area clean. I have never seen a bone infection with this, but I have seen hardware infection. And so this plate's good on the nerve, it's good on the jaw joint, it's good for bone healing, but it's not great for infection. So it's usually the lower plate that needs to come out. So if we need to do another surgery, it's typically taking one of these plates out of there. But my goal is not to do any more surgery on you. Are you getting an implant back here or no?
Hopefully, yeah.
I'll probably put some extra graft in here for you. It won't be a separate procedure at all. It's just that I'm operating back here. So most of the time when people are missing a tooth, since the bone graft is out and you're planning on an implant, I'll just put some extra bone graft back here. I'll tell you about it ahead of time, largely because there is a chance with bone grafting for implants, not for jaw surgery, that the little piece of the graft works its way out, and I don't want you to stress about that. But don't be alarmed if you feel a little grain of rice or something like that on the area. So lower jaw surgery, there's chin surgery as well. Chin surgery, I think the goal of chin surgery in your scenario is really so your chin doesn't move too far forward. You probably were worried about being too chinny with this operation. Chin surgery is a third incision, so it's underneath your lip, and the idea of this one is to take out this middle segment actually. So I know that seems crazy, but it's to take out this middle segment so that the chin is moving forward less than the rest of your teeth. And to quantify that, your upper jaw is moving it's right, it's just, let's call it 10, right? So don't get too caught up in the tenths and hundreds of millimeters. It's not accurate. It's accurate to about 1 millimeter. So from the upper tooth moving 10, the lower teeth are moving about 10. This is basically it. And the overall chin movement is, this is a weird measurement. It's not going back 4, it is going, it's 4 forward, so 4.5. So when it comes to the overall chin position, this is how far we're moving it back. So from a face change standpoint, with lower jaw surgery, it's generally like this. Don't be too distracted by your weird lips with this surgery. But you see how the chin's moving forward less in comparison to everything? Your lips don't look strange after surgery. But face change with jaw surgery is something that I think it'll be less than this amount of face change. When it comes to face change, you see yourself from the front. From the front, with lower jaw surgery, it is width. So from this view, which is a weird way to see yourself, but you see how the lower jaw gets a little bit wider? So face width is, I think, definitely something that you'll notice with this sort of operation. These creases go away a little bit. The 3D simulation does a bad job with that. But from a lower jaw standpoint, the alternative would be not doing chin and then we just leave it to go forward. I just think that's it'll be something that you want me to come back and do later. I think from chin standpoint, that's middle segment, by the way. So the middle segment, that may contain the tongue attachment, in which case I'll bring the tongue attachment forward a little bit further. My example of that is, so she's doing this for sleep apnea. Her x-ray chin's a little bit more similar to your x-ray chin. And so I bring things forward and then her chin goes backwards. Do you see this middle like smiley thing? What that is her tongue attachment. So the tongue, on the middle part that came out, the tongue attachment was brought forward. So it was a little bit further airway change. And that changed her chin, by the way. Like, you see how she had like a prominent like chin. And then you see how that crease went away a little bit? It came back a little bit at 6 months, but it's still like that crease is a little bit different. So I'd expect a pretty similar thing in terms of what to expect with your chin. So I think that's useful for function, and it's also useful for form so that we're not changing your face too much. Upper jaw surgery is an incision underneath your upper lip. So this would be your 4th incision. So remember 1, 2, then 3 for the chin, and then 4th is underneath your lip. Most upper jaw surgery, if we look at your soft tissue, you'll see why, but most upper jaw surgery affects the nose and sinus. So we're like operating right under the nose here. So the surgery is right behind the nose. And so I'll take this part off. The surgery has this widening component on the upper jaw. And so the best way to see this is from above. So what this is doing is widening your upper teeth. And this is giving you more space in your nose. So from a breathing standpoint, the side walls of the nose go out and the floor of the nose widens. Upper jaws, generally stability is the problem. So holding it there and getting it to heal in that spot is much more of a trick than lower jaw surgery. And so there's more stuff holding it. So you can see there's more plates and screws. So there's 4 plates and 16 little screws. These things show 5, but you have 4. But they'll be around the nose on either side. You think, well, that should be enough, right? But it really isn't. There's bone graft. Bone graft will be placed in between here, so that'll be cadaver bone. And then you'll have what's known as a splint. You may have heard about this. A splint, what that's doing is maintaining this width at the teeth level. So from the inside, your upper jaw will be wider, but it'll want to fall back. So you'll have a plastic wafer that lives right back here. It lives right behind the teeth. And so when it lives behind the teeth, what that's doing is kind of helping it stay wide. My last one that you'll notice when you wake up is I'll cut these wires. So the wires that you have bonded onto your teeth, I'll cut them and then I'll glue them back together. And the reason for that is I need to cut that wire to facilitate the widening. And when I glue it back together, that'll allow it to kind of maintain. The splint comes out at either 3 or 6 weeks. If you're doing okay with it, it's 6 weeks. Sometimes it needs to come out at 1 week if it's causing us problems. And usually the problem is that it's over expanding the upper jaw, so the splint holds it in place. But in reality, I think it can also cause it to be a little over expanded. And so we'll kind of, one of the things we're managing after surgery is how long that's staying in there. So upper jaw is more sensitive to things like grinding your teeth, so be careful on that. Obviously you can't stop it from happening, but the plates and screws will be this little step. In real life, it's not this big of a step. It'll be more like a ramp, and then there'll be bone graft that gets placed here. Upper jaw, you have numbness. Numbness is inside your mouth. Right after surgery, it'll be on your lip, but long term, it's inside your mouth, so like on the gum or on the back of your teeth. Inside the mouth numbness, I don't think bothers most people. The arteries I told you about for the nosebleed, right back here. The reason why I keep those intact, so if everything goes great with surgery, those will be intact. The reason why I keep them is blood supply to your front teeth. This is definitely an age-dependent problem. And so people over the age of 40 have quite a bit higher rate of having this happen. but that tooth discolors. So one of your front teeth turns gray or purple. The last time I saw that, actually I saw 2 teeth change. And so we actually took the splint out early to help manage that situation, which didn't really even influence it all that much, but it's hard to predict. All I can do is keep as much blood supply as I can, just be careful with surgery, those sort of things. And so a dentist would have to fix it if that comes up. Not always, but most of the time. And so that's why it's kind of important to keep those in there. So tooth injury, I think, is one of the bigger risks of this. Healing issues, and the other one has to do with face change. Face change and upper jaw surgery, when it comes to like this 3-dimensional thing, doesn't do a great job, but it does an okay job. So most of the negative stuff with upper jaw is around the nose. So the nose will want to widen. So I'll put a permanent stitch there to minimize, and then the tip of the nose will want to rotate. So you see how the tip is
What's
rotating?
the permanent stitch made out of?
Nylon.
Okay, because sometimes my body rejects stitches.
Yeah, there are a bunch of different stitches in here. They all dissolve with the exception of that one. I used to use dissolvable stitch for the nose, but there's imperfections with surgery, right? And so we're trying to manage those imperfections, and I think that you need the support on the nose width a little bit longer than otherwise.
Okay.
I haven't purposely taken that out yet, the permanent stitch, but I've only been using that probably 8 or 9 years. So,
Okay.
but I don't know, that's a reasonable number of people. I think that's probably
Yeah.
like 1,400 people or something. So I haven't seen it. I think if it does give us trouble, we can take it out. It wouldn't be a big procedure. So generally, the overall reason why we're doing this, which is expanding the upper airway, I use limits and kind of like what I think I can pull off on face change. When it comes to these angular measurements, this is for women about as far forward as I want to move them. This is in the face forward position though, so this will bring things out. Guys, I would still move you about another 6 millimeters or so, but overall a centimeter movement. So a 9 millimeter movement is what's associated with the 86% success. So there's a threshold of how far we need to move you to have a high rate of success with the sleep apnea business. Because that's why we're putting you through all of this. And so I want to do everything I can to do the sleep, to get you out of CPAP and get you sleeping better. But there's 2 variables that are hard to predict for me on that issue. So I think we're bringing you far enough forward, but it has to do with muscle tone. Like muscle tone is kind of the concern of doing surgery later in life versus earlier in life, right? Because muscle tone's less. And the other one is physiology. So there's non-responders to these surgeries independent of age, in that people breathe differently, and so different amount. The common ones are like arousal threshold and loop gain. Have we talked about this before? Sorry, I might be boring you too much about this.
No, it's good.
In terms of physiology, so there's different anatomy and then there's different physiology from human to human. And so arousal threshold is like what kind of stimulus wakes you up. Like it's something that wakes you up might be different than wakes your husband up, right? And then loop gains this idea of like after waking up, how quickly you go back to normal. And so people have different set points at how quickly they establish their baseline, which over the course of a night influences your sleep. And those are things that we can change, so unfortunately. So it's kind of like knowing that these physiology variants exist. It's hard to diagnose those still. So, because what I've been hoping is that we can just routinely figure out who those guys are and we tell them we can't have surgery. Because you don't want to go through this and still have sleep apnea, right? But it is the risk of this. So I want to move you far enough to where I feel like we're doing the right thing from expanding things forward, which this is certainly it. I mean, a centimeter movement with things is a good movement. But there's still that risk. So that was the last risk I want to talk to you about. Overall, I think the plan looks good. I think